All right, so it's about 12:05, so we'll go ahead and get started. And the waiting room is off, so people can jump in if they arrive. So welcome everybody. We have Luis A. Mares from Latino Commission on AIDS here to speak with us today. So I'm going to go ahead and pass it over to him. And thank you again for taking the time out of your day to join us.
Thank you very much, Raul and Mercedes, for the invitation to the Latino Commission on AIDS and to me to present about the work we do in New York with the Latino community in the country, especially in the area of HIV and AIDS, with our campaign, the National Latinx AIDS Awareness Day, which is I'm going to present today. I'm Luis Mares. I'm the Director of Community Mobilization at the Latino Commission on AIDS. I've been working at the Commission for over 3 years now. In this campaign that just happened, it's my 4th campaign. And before that, I worked as the Director of Housing Transitional Program for individuals that were homeless living with HIV in New York City. So that's how I started working in the area of HIV. Went into NYU, got a master's, and started working with the commission. So today, today the webinar is going to be, I guess, 40-45 minutes, a lot of talk. So I want to first present to you a little bit of the Commission on AIDS, what we are, what we do. So I'm sure in Hawaii you haven't heard much about us. Then 3-4 slides about a very brief summary of how the HIV epidemic happened in the USA, from the beginning to now. Some data from Hawaii, and then we're going to present what happened with the Latinos and HIV and the reason why we created this campaign and what the Commission does to address the HIV among Latinos. And in the end, I'm going to present the campaign itself. So, take this. Ready. About the Commission, the Latino Commission on AIDS was founded in 1990. Around 1988, data started suggesting that the HIV epidemic wasn't affecting only gay white men, but also affecting minorities, especially Latinos and African Americans. So efforts started to happen around these communities to address the impact of the HIV in their communities, creating organizations that address this fact. And that's how the Latino Commission on AIDS was founded in 1990, to address basically the impact of HIV and AIDS among the Latinos. Later with the years, the Commission has grown, and we have included different diseases or infections that are affecting the community in a disproportionate way, like viral hepatitis and sexually transmitted infections and other health disparities that affect the Latino community. We have programs at different levels, local in the city, New York City, regional in the area of New York State and tri-state area. And we also have national programs through coalitions and agreements with different organizations around the country, and that include Puerto Rico and the US Virgin Islands. We are a small nonprofit organization. We are around 42 members of the staff. We are from different disciplines. We practice different disciplines and work and jobs. We are all multicultural, and most of us are bilingual. The commission was led for a long time, from 1994 until 2009, by Dennis de Leon. He was a human rights lawyer and AIDS activist. He actually led the commission until the day he passed in 2009. Right after that, Guillermo Chacon, our current president, took over, and he shaped the commission a little bit different. He focused a lot on coalition building, community mobilization, and presence in media. The mission that the commission has is to improve and expand the access to healthcare, addressing basically viral hepatitis, HIV and AIDS, and sexually transmitted infections, creating programs that give efforts to create community mobilization and to address health disparities. I mentioned the commission was founded in 1990, so this year we're turning 30 years old, and that's the image here. We're going to celebrate virtually because of COVID-19. So how do we do all the things that we say we do? We have 5 core and complementary services. We have an area that is on health education and awareness, which is actually where this campaign belongs. We provide and disseminate information and education. We work to create awareness among Latino community in different areas, not only on HIV and AIDS, but also on hepatitis. There's another campaign called National Hispanic Hepatitis Awareness Day that happens in May 15. We also have 2 campaigns that are newly created last year about homophobia and transphobia. We also want to create awareness, and we call it the Zero Homophobia campaign in May and the Zero Transphobia campaign in November, which is the next campaign that we're working on. Like this, we have different programs that deliver information and education directly to our clients that come to our offices. We have another part that works on prevention and access to care. Basically, those are programs that are located in our OASIS office, which is a few blocks from the main office in Manhattan, where Latino members of the LGBT community come not only just to look for services, but only to stay and spend time with us. It's like a wellness center where they can stay as long as they want. While they are there, they can receive information about HIV and different infections, but also get tested, get referrals for prevention, PrEP, and if they need any type of medical care, there is a patient navigation program that they can also take care of. There is a capacity building assistance area service program that we have, which is basically one of the biggest part of the commission, and it's funded by CDC. And it used to provide capacity building to different organizations, even health departments around the country. But since last year, because of funding regulations, we are circumscribed to the south of the country, where it's actually where the AIDS epidemic is more focused right now. We have a department that works on health policy and community action. We work doing advocacy at the city level, mostly on February, and March we go to Albany, which is the capital of New York State, and we work there also doing advocacy. And we have a presence in Washington, D.C., where we also can go and work with different organizations to have a platform to advocate for laws that benefit the health of the Latin community in the country. And lastly, we have an area that works in research about the Hispanic health behavioral. We have produced some literature that you can access in our website. The website of the Latino Commission AIDS is www.latinoaids.org. So this is the next slide is about how the epidemic of HIV happened in the U.S. very briefly in the United States, and why the Latino Commission AIDS was created. We all know the AIDS epidemic started in the United States back in 1981, when the first patients were identified with strange symptoms that were rare at the time in California and New York. It took like 2 or 3 years until it was discovered what was causing this strange disease. It has many names from the beginning, but in 1984, the virus was discovered both in France and the United States, and was named finally HIV, human immunodeficiency virus that caused AIDS. It wasn't until 1985 or 85 that finally we have a test, an ELISA test, that was able to diagnose people who were living with the HIV. And in 1987, the FDA and the CDC approved the first medication to treat HIV. There was ACT, cytobudin, but this medication didn't have much effect on the curve of the numbers of the people that were diagnosed and people who were dying. We all know that the AIDS epidemic was a terrible thing to happen in the 80s until mid-90s. And the curve in the image can show you how the numbers of new cases and deaths were increasing dramatically until the mid-90s, when finally high active antiretroviral therapy was introduced, and with new medications, especially protease inhibitors, that had an effect on the health, we believe, with HIV. Right then, you can see the curve going down is when finally, we had medications that treated this condition in a most effective way. And since then, the incidence of new cases and number of deaths were slowly decreasing up until today. No, but different things happened since then until now. In 2006, some states, some areas of the country changed some laws, and it was able to start the routine HIV test. Before, at the beginning, you had to give consents, read it, sign like that, 1,000 papers to be tested with HIV. Now it's different. Now you can give oral consent. Now you can be informed that you're going to be tested, and that's it. In 2012, a new way to prevent HIV was introduced. Back until then, the only thing that were used to prevent HIV was being careful and using condoms. Back in 2012, this pill that was used already to treat people living with HIV, to treat this condition, it was found that this can be taken by people who are not infected and prevent to be infected with HIV. And it's called PrEP. So since the beginning of the epidemic in the 80s until mid 2010-15, the incidence of HIV decreased by more than 60% in the United States. I mentioned PrEP already, and then back in 2016, we started talking about something that is called treatment and prevention. And in 2017, the term U equals U and detectable equals untransmittable was introduced. And it was made viral. It went around the world, which means that people living with HIV whose viral load are undetectable lower than 200 copies per milliliter cannot transmit the virus to other person. And because of all these things that we have now, the testing available everywhere, cheap and accessible, preventive measures that is more than just a condom. Now people can take pills to avoid getting infected. And we know that with treatment, people live longer and healthier lives and reaching viral suppression. And because of that, are not able to transmit the virus to other people. Things get better. And now we can talk about ending the epidemic, ending the HIV epidemic. The first part of the country, the first state that created a blueprint to end the epidemic was the state of New York. Back in 2014, Governor Cuomo called activists, doctors, scientifics that work in the area to work together and create this, what you see in the image, the 2015 blueprint to end AIDS. It's a series of regulations and indications on what to do to end the epidemic by the year 2020, which is supposed to end this year. We won't know if we were able to end the epidemic this year until 2 years ahead, when all these data are collected and produce a report. But same as New York, after New York did this, different states start doing the same thing. And back in February 2019, the federal government of the United States produced their own program to end the epidemic by the year 2030, which is ending the HIV epidemic, a plan for America. Ending the epidemic doesn't mean that we're gonna eliminate HIV from the world or for the country or for the state. It means that we're gonna be able to control the epidemic, that it's not gonna be infecting too many people. Basically, what we want to do is decrease the number of new infections, decrease the number of deaths, and the people who's living with HIV is tested and diagnosed, and those who are diagnosed get on treatment, and those who are on treatment reach viral suppression. There is also a plan to end the epidemic in the world that's carried out by the United Nations, as UNAIDS, and it's called 1990. And basically what it means that 90% of the people living with HIV are diagnosed. Of these 90% are going to be on treatment, and of these 90% are going to be virally suppressed. So I mentioned PrEP, and we had a poster this year from our campaign NLAAD, the focus on PrEP. What is PrEP? PrEP is pre-exposure prophylaxis. And it's when people living without the HIV take a pill, a medicine every day. This was approved by the FDA in 2012 to prevent being infected with HIV. even though they can be exposed to HIV through sex, and the virus can be introduced in their body. If they are taking PrEP every day, the levels of the medication are going to prevent of this virus to take hold of the body. So it's been proved scientifically that PrEP reduces the risk of getting HIV from sex by about 99% when it's taken daily. Today, there's different studies that also have proved that you can take PrEP on demand, which means that you plan to have sex on Wednesday, for example, and then you take 2 pills before having sex, 1 pill the day of the sex, and 1 pill after. It's 2 on 1. But this doesn't work for everybody, depending on the frequency that people are having sex. This is mostly for people who knows to plan very well their sexual life, which is almost nobody, I guess. PrEP also can be used for people whose risk factor is not sex, but is using IV drugs. But the protection in this case is not high as for sex. It's only 74%. So right now we have 2 medications that are sold under the brand of Truvada and Descovy that are approved for daily use as PrEP. Notice that the studies that have been done up until now, the indications for these 2 medications are different in terms of who can use them. We assume that they can be used for everybody, but proved scientifically, the Descovy, for example, haven't been proved for women. So it's only being used for men and transgender women, but not for cisgender women. And I'm going to show you a video that was produced by Health and Human Services, the Department of Health and Human Services, for our campaign about PrEP.
I am born and raised in Puerto Rico, so I come from a very machista society. One of the main cultural challenges that I see is dealing with one's sexuality. And now we can protect our bodies, we can protect our partners, and we can finally come to an end. We can change our narrative. I'm Damian, I take PrEP, and I'm ready to prevent HIV.
So PrEP is also something that helps to have a better sexual health and having a sex positive life, a positive outlook of sex. The other thing that I mentioned was U equals U, undetectable equals untransmittable, which I also mentioned was began as treatment as prevention in 2016. This is a very simple term, very simple explanation. It's like, as I say, if you live with HIV and your viral load is undetectable, you are not going to pass it to anybody. It is based on solid foundation. There's a lot of studies that have been done to be able to prove this. It took off in 2017 when the CDC actually backed this idea and promoted. U equals U means that people with HIV who achieve or maintain an undetectable viral load by taking medication daily and they are adhering to the medication cannot sexually transmit the virus to others. And this is zero risk, it's proof. And when we talk about this, we have to be very clear and say, like, people who are living with HIV and whose viral load is undetectable and they are taking medication cannot pass the virus to other person. So treatment became a powerful tool that we have not just to treat people so they can live healthier lives, longer lives, but also to participate in the prevention of the transmission of HIV. No? And it's also a very important tool to fight HIV stigma. For years, people living with HIV have been carrying this stigma of being the source of infection. But now we know that taking the medication, they can not only do good for themselves, but it's also good for the society. And this is a video, a very powerful video about U equals U and related to stigma as well. If you watch it well, it was done by Beep Healthcare.
There's nothing to see here. No tears, no shouting, no drama. The world isn't ending. Hearts haven't broken. They're just people living.
2 for a pound, 2 for a pound.
Living lives filled with fun and laughter.
Yes! I know you probably wanted half a pint for that. Come on.
With frustrations and worries.
What do you mean?
People getting on with
Just get off the bus
life.
and run.
Because people living with HIV are just that. People living like anyone else. And now there's something new you should know about HIV. A simple, happy fact. Thanks to effective treatment, a person with HIV whose viral load has reached and maintained an undetectable level cannot pass the virus on to anyone else. So there's nothing to see here, just people living.
I love this video a lot because it says it all. Like, people living with HIV is just that, people living independently of if they are HIV positive or not. So I wanted, before going into the presentation, I wanted just to have these numbers from HIV in Hawaii. In 2018, there were 2,436 people living with HIV in Hawaii. Later, you will see how many people is living in the States with HIV. In that year, 70 people were diagnosed with HIV. So the rate of people living with HIV in Hawaii is 200 people per 100,000 people have HIV. Of these people living with HIV, 88% are men, as more or less the proportion that is the same in the country. In Hawaii, the most affected are the white community, followed by the Asian community, the multiracial, and 12.2% of Native Hawaiians and other Pacific Islanders, and 10% of Blacks and 9% of Hispanics. And same as the rest of the country, most people living with HIV are men who have sex with men, MSM. So what I want to show you now are several slides that explain how this epidemic is affecting Latinos in the entire country in the United States. In the year, this data is collected by the CDC and is reported every year in the CDC HIV year surveillance report. And this data is free for everybody, and we use this data to create these infographics that we provide to our NLAAD campaign. The report that CDC produces every year is always a year behind. So this is from 2 years ago, but this report was from the year 2019. We haven't updated much the slides or the images because the changes are very small. So we didn't think that it was really necessary to change the slides. So in the year 2017, almost 10,000 Latinos were newly diagnosed with HIV in the United States. 10,000 Latinos in the country, which is more or less to say like 27 Latinos are diagnosed every day in the United States with HIV. We also know that 1 in 6 Latinos that are living with HIV do not know they have it. They are unaware that they have HIV. So why is this important to know? Because this shows us that there is still a need to promote HIV testing, to inform our people to the need to get tested, where to get tested, and that's why we also have a poster this year about testing. And we also, from the very beginning, our campaign was focused on promoting testing on HIV. it's important because Latinos who are unaware that they are living with HIV do not take treatment, so cannot take the advantage of getting treated and get a healthier, longer life. The disease is going to progress. And that's another thing. Latinos go to get tested when they feel sick. So once they are diagnosed, they are already diagnosed with a third stage HIV infection, which is used to be called AIDS. And the prognosis and the outcome of this is going to be different than a person who is diagnosed when he was just infected. Right now, the indication is like as soon as you are diagnosed, you get treatment. Very different to what it used to be in the past. And also the other thing that is important about this is like people living with HIV and who don't know they have it are unknowingly transmitting this virus to other people. So if we really want to end the epidemic, we need to find these people who are living with HIV unknowingly and continue transmitting HIV. We know, but this data as well, that from all the Latino community, more than half have been tested for HIV. We need to promote testing among our community. There's reasons why people don't go get tested. A lot of it is related to stigma because from the very beginning of the epidemic, HIV was related, a link identified with the gay community, with transgender community, and with people who use drugs. So if somebody goes to get tested or go to the clinic or the place where the HIV is being diagnosed, immediately people is gonna begin to think that this person is either gay or transgender or uses intravenous drugs. And some people do not want to be linked or identified, and they prefer not to get tested. So we have to fight all this social stigma, and we need to normalize HIV testing in order for people to get tested. CDC recommends that everybody between the ages of 13 years and 65 years old get tested at least one time in their lifetime. Okay, so we know that we Latinos, we Hispanics represent only 18% of the population. But we also know that we are going to continue to grow. We are, right now, we are the biggest minority in the country, and we are growing up fast. By 2060, I think it is, we're going to be more than 25% of the population. So any problem that we have now and we don't take care of is going to get bigger with time. In case of HIV, as I say, we only represent 18% of the entire population, but we represent more than 25% of the new cases of HIV diagnosed every year. And we represent more than 20%, 22% almost, of all the new AIDS cases. And these numbers alone can show us how HIV affects disproportionately the Latino community. The following year, in 2018, the same report produced by CDC showed that the total number of cases, in the slide, it doesn't show how many cases were there, but I know it's like less than 39,000. It was almost 40,000. This year, the following year, the cases dropped to 37,968. It's almost 38,000. But the number of Hispanic in the previous one was almost 10,000. Here is more than 10,000. And the percentage was 25.6, and this is 27%. So what we see here is that even though the total number of cases are decreasing, the numbers among Latinos are increasing, and the percentage, the proportion of new cases that represent Latinos are also increasing. And the CDC also produces reports that put together years of data. So they also know that from the year 2008 to 2016, the new cases, the new diagnosis of HIV decreased by 18% in the general population, entire country. And even if you focus on Latinos, it also decreased by 4% during that time period. But if we focus on a subset of people, in this case, Latinos, men who have sex with men, MSM, Latinos, the cases increase instead of decrease. So this is another way to identify what population, what group of population is more aggressive addressing the HIV epidemic. We know that MSM of any race, of any ethnicity, represent the group that is most at risk to get infected with HIV. So new programs need to be created that address this factor. In the year 2018, same as the previous slide, the number of cases, the number of people living with HIV in the country is 1,025,744. I also mentioned that some people do not know they have it. So the estimated number of people living with HIV is like 1,200,000. These slides show you that the reality that the community most affected is not us Latinos, the African Americans. They are the biggest proportion of people living with HIV, the biggest proportion of new infections. The difference is that even though they are still the bigger group, the numbers are dropping. They have been constantly decreasing while our numbers are increasing. That's the difference. So in this slide, you also can see the difference between the rates of infection among whites, African Americans, and Hispanics. African Americans are like 7 times more at risk to get HIV than whites, and Hispanics are like 2.5 times more at risk than whites to get infected. There's also data on Hawaiian natives and Pacific Islanders. The risk is almost the same as the white population. So if these trends among Latinos continue and nothing is being done, 1 in 5 Latino MSM, Latino gay bisexual men, are going to be diagnosed with HIV in their lifetime. 1 in 48 or 1 in 50 Latino cis gender men are going to be diagnosed with HIV in their lifetime, and 1 in 227 Latina women, cisgender women, are going to be diagnosed with HIV in their lifetime. About the trans community, there is not much data about transgender men or women. It wasn't being collected for many years. It was included as gay men or in the women group, but we know that the transgender community needs to be considered separately because their needs are different than gay men or the cis women. So after a lot of work through organizations and going to advocate and request the transgender community be considered separately, data was being collected for the past 2 or 3 years. And for now, we are estimating still, and we are calculating how many people are infected and living with HIV in this community. We know that the transgender women of color, Black and brown transgender women, are a very, very higher risk than any other community to get infected with HIV, and they are living with HIV. There are many risk factors for this because they live under a lot of discrimination. It's very difficult for them to find jobs. They also have their own ways to use their hormone therapy, and sometimes they inject themselves and they do not use sterile syringes. So there are many factors, and sometimes they have to work, and as they do not get regular jobs, and they had other options than to do sex work. And through sex work, you can get infected as well. So we know now that about 1 in 4 Latina women are living with HIV, and that's a very, very high number. It's like 1 in 4, 25% of the entire community of transgender Latinas are infected with HIV. The following few slides, I'm going to show you where this epidemic is being located these days in Latinos. In 2018, of all the diagnoses among Latinos, most of it was located in the southern states. And when we say South, we mention, we include from Texas to the Atlantic Ocean, from Florida until under Washington, D.C., which is Virginia. So most of the new diagnoses are located in the south of the country, and people living with HIV are still more located in the northeast, which is the New York area, a region. And this slide, which is from a year before the data, but it's still the same, show you that between the south and the west, accounted for almost 3/4 of all the new infected Latinos with HIV in that year, which is almost where the Latinos are living mostly, is the west and the south. There's also some areas in the northeast, which is New York, but mostly these states here, the south, and these states here in the south of the west also are very high prevalent in Latinos. So which states are the has the high number of HIV, Latinos living with HIV or diagnosed with HIV? California, as we expected, New York, Texas, Florida, and Puerto Rico. And the next slide represents the same thing, but it gives you a number that in these 5 locations, 5 states, it accounted for almost 70% of all the new cases of HIV among Latinos. Before I get into this, I mentioned at the beginning of the presentation that there is already a plan to end the epidemic in the country by the year 2030. It has phases, and the first phase of the plan is to provide more attention to areas where people living with HIV are concentrated, and where the new cases of HIV also are concentrated. And these areas are mostly located in these states that we mentioned, but it's by county. I can't remember the number right now, but it's a certain number of counties. And these included Washington, D.C. and San Juan, Puerto Rico. And they also include 7 states, rural areas where the cases are going higher. And this is the 7 states are south of the country, where I was mentioning, where the epidemic is more concentrated for every ethnicity and every race. When we talk about Latinos, we have also talked about immigration. We know that more than half of the Latinos that are diagnosed with HIV and who disclose their place of birth were born outside the country. This doesn't mean that they come here with the virus. It means they come here and get infected here in the States. Why is it important to know? Because we know that when immigrants come to the States, there are a lot of factors, a lot of conditions that they have to face that are very difficult for them. Lack of medical insurance, difficulties with the language, no access to medical care. So all these things together, together with discrimination, racism, and all these other factors, put these people at a higher risk to getting infected. And the results is this, that many of them are going to be infected with HIV. And I also mentioned PrEP at the beginning. Since 2012, we're using PrEP. And we know that the HIV epidemic affects mostly or more African Americans and Latinos. But who is using PrEP? PrEP is being used by the white people. Earlier today, I attended another webinar and I learned that 25% of the people that would be benefit by using PrEP are Latinos, but only 3% of the people are using. And this represents that of all the users of PrEP in the country, only 13% are Latinos and 11% are Black or African American. Most people using PrEP are white. So all this data and all these numbers and all this information make it clear that HIV among Latinos is a health disparity. So why do this happen? We know that the epidemic is being controlled. We know that we have a lot of tools to end the epidemic. The curve in the United States is going down continuously. Why Latinos are not following the trend? Why all these numbers are showing us different. There's a lot of reasons. First of all, for part of the government or the health departments, there is a lack of knowledge about the healthcare challenge faced by us Latinos. We Latinos seek healthcare in different ways. We can go in our own countries is different than when we came here. So we came here to the States and we face something different. You have to have a medical insurance card. You have to speak English. Things that make our access more difficult to healthcare. There's also a lack of understanding about how diverse our community is. We are all put in the same bag, we Latinos or we Hispanics, but it's different. It's different if you are born in Argentina or you are born in Mexico or in Cuba or in Peru or in Brazil. We all come from different cultures. We may speak the same language except Brazil. We eat differently. We have different health conditions, and all the things that are going to affect how HIV affects us, but also when we create programs and messages that are going to be directed towards our community about any of these factors that's going to affect or teach us or giving information about HIV, we have to make it in a flat, plain Spanish that everybody is going to understand. If we use language that is very common use in, let's say, Puerto Rico, so probably somebody from Chile or Ecuador is not going to get the idea of what the message is trying to convey. There is limited linguistic and culturally competent services. Also, when we create messages for Latino community in Spanish, we have to create them in Spanish from the beginning. We cannot continue to translate messages that we create for the people that speak English into Spanish. In the translation, many times we lose the message. We lose the important part of the message. And sometimes we don't understand what they're trying to tell us. Many times I just walk into the subway in New York and I read some poster or flyer and I don't understand what they're trying to say. I mean, I do understand, but I read it and you say, this is wrong. What they're trying to say is not really well expressed here. So again, when we're trying to create programs and messages for Latino community, we have to create it from the beginning in Spanish, and we have to involve people that speak Spanish to create these messages. We cannot create messages in English and just translate them. There is a lot of discrimination and racism, especially these days. There is fear about immigration. There is fear about the rules that this government has created about immigrants. So people is not going to go to seek treatment or be tested or take PrEP because you require a prescription for PrEP. They are not going to go to the hospital or the doctor because they fear that they're going to be reported to ICE or immigration. There is a lot of xenophobia. There is also a lot of transphobia. There's homophobia. There's a lot of these phobias that affect the community, and in their ways they're going to access healthcare. Also, there's a lack of Hispanic healthcare for workforce. For example, in California, the Latino community represents more than 30%, I think it's 33% of the population, but only 5% of the health service providers are Latino. There is a need to impose, to make the young members of the Latino community go to school and get involved in healthcare careers. Why is this important? And I think it can, all of us know that if we go to search for any type of service, we feel more comfortable if we talk to somebody who looks like us or talks like us. It's the same in the healthcare. Latinos want to be treated by Latino doctors. African Americans prefer African American doctors. Asians prefer Asian doctors. It's the same. It doesn't mean that either one is better. It's just you feel more comfortable, you feel more open, easier for you to transmit your fears, your feelings, and your symptoms. So also there is a lot of challenges faced by new immigrants, as I mentioned. One thing that is important, I was just talking about this with somebody for the COVID Prevention Network, is that there is a lack of Latino representation on research and health studies. Like, for example, there's a lot of research that is being done these days about COVID-19. And we know that COVID-19 affects Latinos and African Americans more in a disproportionate way, same as HIV. So the studies that are being done in search of a vaccine needs to include a big number of Latinos and African Americans in order to be able to say that when the vaccine is approved, this can apply to these communities as well. And like lately, lastly, challenges proper of aging on the Hispanics that are getting older. The longer you live, the more health problems you're going to present. And if you have HIV, you have to be careful about the complications that these diseases can have. So despite this, as I mentioned at the beginning, all this progress in the fight against HIV, now we can say that we can end the epidemic, we can decrease the incidence. The incidence of HIV diagnosis are decreasing. They are still increasing among Latinos, and driven primarily by new infections among MSM in Latino youth. The numbers are going up, not in the older group, not in the very young group. It's basically between the ages of 18 and 39 years old, where the numbers are going up. So we can say that there is an invisible HIV crisis in the Latino community that deserves, that needs increased national attention. And there is also a great need to address the problem and difficulties caused by what we call social determinants of health. What are social determinants of health? Are all these factors that are ingrained in our society that are going to determine who is more at risk to get certain type of health conditions, in this case HIV, which are poverty, education level. The more poor you are, your risk of getting HIV or your risk of getting HIV and progress to AIDS faster is higher. Education level, if proved that the higher education level is, you're going to have a better lifestyle, more income. You're going to live in areas where you have access, easy access to hospitals and doctors. You have your own transportation. You don't have to worry about that. So income level, education level, occupation, and where you live are going to determine as well how well your health is going to be. Housing, homelessness. If you live on the streets, obviously your health is not going to be as good. You're not going to be able to have a place where to have your medication. If medication requires special conditions, you are not going to be able to handle that. Healthcare access and quality of healthcare access is also very important. If you are poor and living in the poorest neighborhoods in the city, probably you are not going to be able to have easy access to healthcare. If you live in the rural areas, it can take you hours to get to the closest doctor. And if you don't have transportation, you are going to depend on public transportation. And public transportation in these areas are not really good as they can be in the rich areas where they don't really need much because they have their own transportation. But all these factors that we know exist in our society in this country determine how your health outcome is going to be. And these are the social determinants of health. So what we do at the Commission, how the Latino Commission NLAAD respond to the HIV epidemic. As I said, we were founded in 1990, and since then to now, we have created new programs and grown into a bigger organization. Initially, we were located only in one office in Manhattan, New York. Now we have three offices in New York, one in Manhattan, two in Manhattan. The main one where we are located, which is the management office and the programs that work in policy and in capacity building and in awareness, like I do. So we have another office called OA'S, LGBT Wellness Center, which is a few blocks away from us on 7th Avenue and 29th Street, which is a bit different. It's like an area and a big space where Latino LGBTQ members can come and just hang out, but at the same time they receive services. So that's one of the components, one of the programs that we have. And we have opened recently one office in Brooklyn, which is mostly focused on redirecting people to OA'S and also to doing HIV testing and patient navigation. But based on the distribution of new cases in the country, we also mentioned that the HIV epidemic is moved the epicenter to the south of the country. We opened an office in the south, in Raleigh, in North Carolina, where Latinos in the south, Latinos in the deep south is located. And we have a staff disseminated in Florida, Georgia, South Carolina, North Carolina, Texas, and I think Tennessee. So we have, through this program, influence through agreements and coalitions with different organizations in the area that provide services to Latino community. Through them, we do the same thing that we do in the main office. We do capacity building, we create awareness, we create conferences where all these people can go and learn about HIV and what to do in cases if they want to provide services to their community and work together for the improvement of the health of the Latino community in these states. There are 7 states that are included, from Tennessee to Florida and from the ocean to Texas. As I mentioned, we have capacity building assistance, which is Hands United is the name of the program. Right now, we provide capacity building only in the south part of the country as well. But it's one of the longest programs that we have, funded by CDC. We have been providing capacity building to the entire country, including Puerto Rico, for years. And it's very well known in the country. And we have also the Latino Religious Leadership Program. This is the logo here, because we consider that it is very important that we educate and we provide information to the religious organizations. This is only in New York City. We Latinos come from very religious countries. Most of us Catholics. Where talking about sex is taboo, where being HIV positive is seen in a bad way, where being LGBTQ is seen is being discriminated. So we associate religion with this discrimination, taboo, seeing you're doing something wrong. So what we're trying to do here is to educate the leaders of the religious organizations so they can as well transmit this information to their people, to their communities, to the church choirs. In this way, we're trying to fight stigma, to provide education, and to break this idea that many Latinos have with religion. We are very religious, we believe in God, and we go to church, but we feel bad about part of our lives, and that affects how we access healthcare in this area of HIV and AIDS. And lastly, recently we had the National Hispanic Latinx Health Leadership Summit 2020, and this happened right before COVID-19. We were in Washington, D.C. doing this, and we got together with hundreds of representatives of different organizations that provide services to Latinos around the country. And we together created an agenda that is going to be released these days, I think, that can be used to advocate for the improvement of health in certain topics. We chose 6, we all agree, which ones are going to be the 6 more important topics. One of those is HIV. That affects the Latino community and that we want to see improvements. It's going to be presented to whoever wins this election that is happening these days. And it can also be used at any level. If you want to advocate for the improvement on the health of the Latinos in your area, let's say, for example, you Hawaii, you can use this and go to the government in your state and use it as a tool to advocate for the health of Latinos. The other program that we have is the National Latino AIDS Awareness Day, which is what I want to present now. So the National Latinx now AIDS Awareness Day is the Commission's signature awareness initiative. It's the biggest one that we have. It's the oldest one that we have. It was created in 2003. So this year is the campaign number 18. It was created to draw attention to the critical role, the important role that HIV testing and prevention education plays in stopping the spread of HIV among Latinos. It is celebrated, it's observed on October 8-15 every year, just passed a few days ago. On this day and around this day and previous to this day, the Commission mobilizes different community organizations. Usually, it's not that we want only 25 states. It happened that to be that 25, 26, 27 states participates across the country, and they host HIV events where they transmit education and awareness about HIV. They can now these days they distribute condoms, but also put people in contact with PrEP. They educate them about PrEP and they refer them to places where they can receive prescription for PrEP. And from the very beginning of this campaign, testing was part of this. So we are still pushing for testing in our campaign. So this image here is the first poster that we had. It's October 15, 2003. Our campaign then was called Abre los ojos, open your eyes. Clearly, the intention of this campaign at the very beginning was to make the Latino community, all of our members, to realize that something was happening. The HIV was happening and it was affecting our community. Up until then, people didn't want to talk about it. I'm not blind, it's not gonna happen to me, but it was happening to everybody in the community. So we wanted the community to know about HIV, to learn about HIV, to educate themselves about the importance of testing at that point, the use of condoms, and how to prevent getting infected with HIV. No, it was developed, created by the Latino Commission on AIDS together with Hispanic Federation in 2003. It is a national campaign that is implemented, is created at a macro level, which means we, Latino Commission on AIDS, every year create this campaign with some help from different organizations through calls like this one, for example, and we have brainstorming ideas and suggestions, and we took all this information and we created a campaign according to what's happening in the reality in the moment in the country. But also we decide what message we want to convey with the campaign, what we want the community to learn from this campaign. So as I mentioned, the first one, we wanted the community to know about this and to learn about this. So, but the campaign is not implemented at a macro level. It's implemented at a local level, which means every organization that wants to participate of the campaign, they own their event. They create the event. They have the idea and they can do as simple as just testing day, as more creative and flamboyant things like beauty pageant or drag queen show. They can do a party, they can do a cultural festival, a food festival, a health fair. They can do a lot of different things. Every organization is free to design their own event. They can use our poster because we send posters to the organizations. But they also can create their own poster, or they can do a combination. They can use ours and same variations. Every community has to create their own event according to what they know their community needs and wants. It can be a whole event in Spanish, depending on where the event is going to be. It can be bilingual. You can give free gifts to the people who attend, and you can promote testing, and you can say like, whoever gets tested gets this gift card, something like that. So again, every organization creates their own event. We provide, as I say, at a macro level, with the platform, which is our website. We provide with materials such as posters that we send, infographics, the ones that you saw at the beginning of the presentation. We also coordinate donations of HIV tests from companies like Ora, Sure, like Abbott. Before it was Alere, now it's Abbott. Like Biolytics. There are companies that produce HIV testing. So let's say I am an organization in California, and I want to have an event, and I want to do testing in my event, but I don't have testing tools. I don't usually do testing, so I don't buy tests. I don't have money to buy tests. So at the moment that I raise my event with the campaign, I can also request a donation of HIV tests, and we coordinate those. Previously, before the campaign started, we had to do all these coordinations. Who is going to help us with donations, and we coordinate that donation goes directly to these organizations that request HIV tests. So NLAAD is a collective movement. I say collective because even though we created it many years ago and we still organize it every year, we cannot do this alone. We need the work, the effort, the cooperation of different organizations around the country in order for us to reach those corners of the country and to be able to convey the message that we carry every year. No, and this is going to be able to make a real goal to educate and mobilize Latino communities and increase the knowledge about HIV testing, prevention, and why is it dangerous, why HIV is still a dangerous thing among us Latinos, and why is this high prevalence happening in our communities. So our objective every year is to draw attention to focus and teach our community about HIV diagnostic tests, educate them about PrEP and PEP. PEP is a post-exposure prophylaxis. It's like something like the pill, the after-day pill. If I get infected, if I get exposed unknowingly or unknowingly to HIV, let's say I had sex yesterday and I didn't use a condom, and the person I had sex with, I don't know if he is or not positive, or maybe I know he's positive, but I don't know if it's undetectable or not. So I go to the emergency room when I express PEP, and they had to give me medication for a month. And this is going to prevent that in case I was exposed, this infection stays with me. We also want people to learn about care and treatment. Why is it important that people living with HIV needs to be connected to a doctor to treatment? And lately we incorporated things like U=U. It's also a part of the campaign now. And all these things play a very important role in all the plans that we have now to end the epidemic. So through the years, I mentioned that we already have 18 campaigns, and every campaign has a poster, and every poster has a message, and a message has been changing through the years according to what we wanted to the community to learn. So initially it was like, open your eyes, and something's happening. We need to learn about it. We need to know about HIV. Things were changing, and the message the following years was kind of the same. We were trying to let the community know that the HIV has no frontiers, which means like no matter where you come from, and no matter what your color skin is, you still are at risk of being infected with HIV. Then we changed a little bit into like, you need to know in order for be able to prevent, or in order to be able to get treated. And then we move a little bit to community, like we should all be together in this. We should all work together towards fighting this epidemic and ending this epidemic. And this is going to be a very important role in all the plans that we have now to end the epidemic. So through the years, I mentioned that we already have 18 campaigns, and every campaign has a poster, and every poster has been changing through the years according to what we wanted to the community to learn about it. We need to know about HIV. Things were changing, and These
Hi,
are
Louis, just a quick point of order right now. We are running out of time and we have
Oops.
some members that have to get to class.
Okay.
And I know some people might have questions.
All right. I'm going to be very fast.
I apologize.
Okay, sorry. So these are the 4 campaigns, the last 4 campaigns. The last 3 ones are the one that I participated in. So since the beginning of the campaign, more than 80,000 people, Latinos, have been tested with HIV. We have been able to mobilize more than 500 community-based organizations, around 250 cities, and included 40 states. We have been able to maintain a network of CBOs, health departments, federal agencies included in this list, and we continue to promote HIV testing, PrEP, condom use, HIV, and U=U. This year, our campaign was NLAAD 2020, campaign number 18, and this is the main poster. And we talk about that everything is our fingertip. All this testing, condoms, PrEP, treatment is our fingertip, meaning that we have at the reach of our hand all these tools that we can use to end the epidemic. And we use, unlike other viruses, because we're going through another pandemic, COVID-19, which is new, and we do not know yet many things about this, different to HIV, which we know. This year we have 6 posters, one for each one of the tools: testing, PrEP, condoms, treatment, U=U, and a general poster about everything. It's at your fingertips. We also have a website, NLAAD.org, where you can go and check information about the campaign, about HIV testing, and all this information that I mentioned. And if you are, every year we ask people to register their events. This is the registration page. And once they are registered, for example, our event today is here, it's on our website. We put every registered event in the website, and we immediately coordinate donations of HIV tests. This year we only had OraSure, and we sent like 20 events have received. These are posters from last year events, different to this year you're gonna see. As I mentioned, events can be of different types. There was a dance, a beauty pageant, a food festival, different things. This year, because of COVID-19, we were not able to have all these type of events, but we are very happy that we have been invited, like today, to do presentations about HIV and Latinos, to do presentations about NLAAD, and to communicate through the internet and the radio. We have been able to reach a much higher number of people that have heard about HIV. And we also have social platforms: Facebook, Instagram, YouTube, and Twitter. We tweet a lot, and we post a lot on Facebook. And in our YouTube channel, we have all the past webinars that we have provided through the years. This year, we have 4 webinars, very well attended. We considered it was very important to tell the community about self-testing during COVID-19, because the number of tests has decreased a lot because everything is closed. We talk about social determinants of health. In the middle of this pandemic, we also went through another crisis about social injustice and racial inequity. And we wanted to make sure that people learned how these things affect this epidemic. And we brought the Health and Human Services to talk about the program that I mentioned, Ending the Epidemic, a plan for America, and how COVID-19 has affected these plans. And we also had one about U=U, which is our new part of the campaign. Every year, we also have a press conference that we held in New York City, in the City Hall, Step City Hall, with different organizations that come together with us, and the health department, the state, and the city. And we explain why we still need to have this campaign every year, and we still need to continue to create awareness. This year, there it is. We didn't have a press conference, but we were able to deliver. I'm going to play part of it. There it is.
Buenos dias and good morning from New York City at the New York City AIDS Memorial, where the epicenter of the AIDS epidemic was located almost 40 years ago. And welcome to NLAAD 2020. This year, Because of COVID-19, we are not able to congregate. We are not able to be together as we always like at a press conference, a live press conference. So we decided to do this virtual press conference with information about NLAAD 2020, and we're going to give you, we're going to bring you people from different parts of the country, from Hawaii, California, Florida, New York as well. So NLAAD 2020.
Ourselves because COVID-19, but our commitment to advance ending HIV.
We're here today filming from Hilo, Hawaii, and we represent Kappa Pharmaceutical Fraternity here at the College of Pharmacy. And we just wanted to share a little bit about why we decided to bring the National Latino Awareness AIDS Day to our community.
So the reason we're bringing it here is to try to break down the barriers and create an atmosphere where we can have an inclusive, diverse community and have access to treatments and prevention measures in place.
So through awareness, education, and breaking down the stigma, we can reduce the numbers of new HIV diagnoses in the Latino community.
Thank you.
Decir que mujeres transgénero o
We have
mujeres o personas que
a representative for the transgender community from Florida. We have somebody from California that works in LGBT community, and we have somebody from Colorado who also works with the Latino community in terms of HIV prevention. And we ended up with the call to action.
Test often, know your status. Usa condón, previene el VIH.
Prep yourself, prevent HIV.
Busca tratamiento, mantente saludable. And remember, ending HIV is at your fingertips.
This is the last slide. So every year we have to produce a report, and of course we have not a report for 2020 yet. But last year, in normal circumstances without COVID-19, we were able to reach to 40,044 people, and we had a number 106 events, and in 24 states. The type of event were different, as I mentioned at the beginning. We have 5 webinars per well attended as well. The most important part is we have 2,129 HIV tests. Of these, 7 came out positive, and these 7 people were connected to treatment. We distributed a lot of condoms, and 316 people were referred to PrEP. NLAAD is recognized by the official government agencies like CDC and HIV.gov, which is Hospital and Services. ACE-BU and POS are very important documents online and printed that also recognize AIDS, and we were invited at one time to New York One News. Finally, in Hawaii, as I mentioned, Latinos represent less than 10% of the population, but it's supposed to grow 16.88%, much faster than the rest of the population in Hawaii. With Latinos growing in numbers, not only in Hawaii, but in the entire country, we are still alienated from the health system. The numbers that I show you about how the HIV epidemic is affecting the Latino community is just a few things that we can mention. The challenges are worrisome, and we react to them with programs that are going to try to tackle these factors. And what we want is to improve the health of wellness of Latinos, and in this way, of all Americans. Thank you very much, and sorry for the long presentation. These are all my contact information. You can go to this website, so you can write directly to me. That's it.
Awesome. Thanks again, Luis, for taking the time out of your day to speak with us. And unfortunately, we don't have time for questions, but I'll go ahead and email your contact information out. And if anybody does have questions, we'll.
Yeah, definitely. You can email me, and I reply very fast.
Sounds great. Thank you again. We appreciate it.
Thank you.
Thank you very much. Thank you for the opportunity.
Bye, everyone.